Lupus LA would like to thank our generous sponsors for their support of the Your Story, Our Fight podcast. Gemini Beauty believes in beauty for a cause, and in their case, the cause is lupus. The team at Gemini is changing the skincare game for good. We thank GSK for their focus on autoimmune disease and their continued support of Lupus LA. Hello and welcome to another episode of the Lupus LA podcast, Your Story, Our Fight. I'm your host, Adam Selkowitz, and I want to thank GSK Pharmaceuticals and Gemini Beauty for sponsoring us and allowing us to tell these incredible lupus stories. And we have another one here today with Risa Regalado, who is a dental hygienist, but has a terrific story, I think, about perseverance and the power of a dream and living the dream. And she's on her way to being a dentist. But a lot of this relates to your lupus story. And we're going to get into that on the show. And we're going to talk about how that's come to be. So welcome to the podcast, Risa.
Thank you. Thanks for having me.
Of course. So I heard your story from one of our board members, from Sheba, one of our last podcast guests. And I was so inspired by it because I think that what happens to a lot of lupus patients is sort of what happens to you. The disease really derails sort of the direction you're heading. So let's get into it. So tell me a little bit about where you grew up and how you grew up and when the lupus started to appear in your life.
So I grew up in Laguna Niguel in Orange County. I have two older brothers. Historically, I didn't have any symptoms, never had any health issues growing up. And I went to college at UC Santa Barbara. And it was when I actually graduated that I started to feel symptoms. It was the summer after graduation that I was already planning on going to dental school that I started to have symptoms. It started with swollen lymph nodes, a headache. I was feeling like sort of like low grade fevers, muscle aches. It just started to little by little every week there was a new symptom. But, with lupus, it can affect any part of your body. So it felt very ambiguous. It didn't, there wasn't a whole picture. It wasn't only until I started feeling arthritic in my hands mostly that I knew something was pretty wrong. And at the time, I had already graduated, moved to LA because I had intentions of hoping to get into one of the dental schools in Los Angeles. And I was working for a dentist in Santa Monica as a dental assistant. And when I told him I had arthritic hands at the age of 21, he knew this has to be something immune related. And that's when I first started seeing a raumatologist.
So when you first got these symptoms, when you get a swollen lymph node or et cetera, did you go see your GP or any doctors or you just sort of kind of dealt with the symptoms one by one?
Yeah. So funny story with that. Originally, one of the symptom that actually made me go to the doctor was the first one was the lymph nodes. I had had a history of tonsillitis, but I had already gotten my tonsils removed maybe at age 19 or 20. So I didn't even have a GP in Los Angeles because I had just moved there. So I had to go find, I just went down the list of who was covered by my insurance and I found a GP. I won't name any names, but she wasn't the greatest because when I went in, they pretty much told me that I had my ANA checked. I think I tested positive for just, any autoimmune, but they didn't know which. And basically at the end of my visit with her, she had said, either you have some sort of autoimmune like lupus or you have lymphoma. And I was so scared. Imagine 21 years old, just graduated, so used to late nights and drinking with my friends. And here I am worrying about having lymphoma. So they did a biopsy where it was the most painful thing ever. And I remember just calling my mom that evening and telling her that I thought I might have lymphoma, because when I met the doctor, she said, these are the two choices. I think you have, I'm leaning more towards lymphoma.
Oh
So
my gosh.
so you can imagine, by the time that I did get my official lupus diagnosis, I was like, thank goodness, like this doesn't seem like a death sentence to me. You know what I mean?
Yeah.
So
I mean, I guess thank God for small favors, right? But but that's an interesting, I will say, I mean, on the plus side, she knew she was heading in the right direction, at least one of the right directions.
Yeah.
I think the bedside manner is probably needs a little
I don't
work.
think she should have jumped to that conclusion so quickly. And, especially like me coming in by myself, not having any idea about either of them. It was a pretty scary time. And I remember when I told my mom that evening, she was pretty shaken up about it as well. So.
And the dentist that you were working for, was he the one that kind of prompted you to go see the doctor? Okay.
Yeah, he's been the one that, like, he's been there from the beginning till the end. So, yeah, he saw it from the very beginning. Yeah. Which
is great. I mean, I think that's half the battle, because these symptoms are so sporadic and spontaneous and random, and, all that, and to be able to sort of gather that from even the small amount of information is really impressive.
It's really hard to explain to people, because the period of time that I was getting the diagnosis, I was not having any like pharmaceutical treatment, because they're still figuring things out. So that's when my symptoms were the worst. And I mean, they can get really bad, especially the arthritis. It was hard because, everything in dentistry, you use your hands. And there were times in the morning, like, it would take me like 2 hours to get ready, because I literally felt, I would call it like defrosting. I would, when you wake up, the inflammation settles in your small joints. And so you have to sort of get them warmed up. I would like run a bath, like a really, really hot bath, and soak in it for at least 30 minutes before I could get my joints moving. Otherwise, I wouldn't be able to dress myself. It was that hard. So trying to explain that to your employer, that, I'm running a little bit late for work because I'm in, pain. It's a little bit difficult. And I think that was part of the hardest thing, is people don't realize you look fine on the outside, but it's really hard to explain like what you're actually feeling on the inside. Yeah.
So at this point, you're still thinking, I'm going to go to dental school. Did you make the connection that this arthritis and joint pain could be, could be a blockage to being able to reach that dream of being a dentist, or was that a later realization?
Absolutely. I mean, when I first heard that there was something wrong, my first question to people was, do you think I could go to dental school? I think when I started seeing a rheumatologist, I was like, what does this mean for me? Like, immediately, that was my main concern, because I had just spent 4 years in college being pre-dental and working my butt off, and I just didn't know what that meant for me. And I was really stressed out, which probably exacerbated the situation, because I didn't want to take a break. I'm not the type that takes breaks ever. And so even just planning all the doctor's appointments, Los Angeles has so much traffic. It's not like an hour out of your day. It's like half a day, like to and from. And so my question was right away to the doctor was, do you think that I can still go to dental school? And I remember at the time, Dr. Wallace said, well, there's a lot of testing we have to do. So you got to make time for all the testing, and we have to test out the medications too. It takes several months, even years, for medications to kick in and for us to figure out what is going to work best for you. So, when I had my talk with my family, it just seemed like it wasn't the best idea for me to go immediately. And to be honest, at times the pain was so bad, everything else that consumes your mind on a regular basis kind of withers away when you just don't feel good. All you care about is feeling good. So I think I started to jump on the wagon, like this probably isn't going to work out for me this year at the very least.
I think that's a really good point, that when you are in pain or you're experiencing any symptoms, that piece of your mind that focuses on you and your health and your body is huge, and it sort of really takes over, and it colors everything else you're thinking about. It's like a running,
definitely
repeat in the back of your mind.
Definitely.
So tell me, when you make that decision and you make that realization, how does that affect you?
I think at the beginning, you still are a little naive to it because you don't really realize what the lupus journey is until you're in it and you've been in it for a while. So I think in my head, I thought, okay, maybe it'll be delayed a year. Some people take a little bit of a year off after undergrad and then they continue on. So I said, that's fine. I think I can do that. But shortly after, you realize, no, like I'm making like big long-term decisions now, because some of the things that we had spoken about, like I was worried schools would not find me as competitive if I took a year off. So I had decided, well, maybe I should apply to hygiene, dental hygiene, because it's in the same lane, just a little bit. I'd just be sidetracked for a little, and maybe I'd be a better candidate in that case. So that was already, okay, well, now I have to change my whole 5-year plan, because that's a 2-year program. And then I have to reapply. So already the next 2 to 3 years of my life has changed. And even, at the time I was even dating somebody that I thought it was very new, 3 months in. And my doctor had wanted me to was thinking of what drugs to give me. And one of the options was going to be mycophenolate. And mycophenolate can reduce your chances of getting pregnant in the future. And so he had asked me oh, well, are you dating somebody that you might want to be with? And I was like, I don't know. We've only been dating for 3 months. So basically he wanted me to go see my OBGYN to possibly talk about freezing eggs or, have such serious talks. And then he had told me that if I was with a partner that I was serious with, maybe I could talk to them about having my egg fertilized. And these are not the conversations a 21-year-old is used to having, And
Right.
So it was a pretty heavy period. All of a sudden it was you have to start thinking about your next so many years, because everything that I was being treated for affects my future. And, good thing I didn't ever have to take mycophenolate, but it was an interesting conversation with my boyfriend at the time.
Yeah.
Yeah.
Who is, I presume, is not your boyfriend now. And so therefore it would have, it could have really gone a different way.
Exactly. Yeah. So,
pretty much. So and I think that, you have to be super brave to make those decisions. And I think, and I always, it's like a chicken and an egg thing, but how do you feel like the stress you were under about making those decisions affected your health?
I think the first few months, absolutely. It was just like a tumbleweed. I feel bad. I'm learning all these new things. I'm reading all the things on the internet, in these chat rooms, reading worst case scenario. It was just tumbleweed, worse and worse and worse, snowball effect, definitely the stress was just getting to me until I think you really do, you hit your bottom. Because I do remember a time when I think it was the holidays, and it, everyone's starting to find out, you're canceling all your plans. And I think that was one of them too, is, the holidays are stressful in general. And I had to cancel plans with people. My mom had to explain to people why I wasn't there. We went on a trip that I couldn't cancel. And on that trip, my hair was falling out. That, the stress was just exacerbated until finally during that period, it was just my mom had said, you got to take a break. No work, no school prep, no nothing. You have to just stop. And I remember I I moved out for like just a month, maybe like 3 weeks, and just like left everything, stayed at my mom's for like 3 weeks to just decompress. She took care of me. Like I had somebody, because I'm very independent. I don't like, she asked to go to my doctor's appointments. I said, don't worry about it. I don't want you to, because she was in Orange County. It's lots of traffic. I'm fine. Until I kind of realized it would be nice if somebody helped take care of me. So during those 3 weeks, I sort of got my ducks in a row, came up with plans. All my results were coming back. And then the stress level was able to, like, I think people also gave me lots of books. I read every book that I could during those 3 weeks because I wasn't working or going to school. And that's when I got as much information that I could from every direction I could, I felt like I could get a little bit more control of my situation. And that's when I think the stress level started to decrease. But that's life in general, right? I think I kind of work like that in general. When I'm stressed out, if I have lists, if I'm organized, then I feel like I have more control.
Yeah. No, control, I think, is a really big part of owning your disease.
Yes.
And especially if you're a control person in life,
yes,
getting that control over the illness is so important to recovery. I think.
Recovery. And also just, I think kind of, there's so many resources out there, just like, Lupus LA was one of the first things that I looked at and read everything that I could from you guys. Just the constant like feeding of information, it helped, it helped so much.
Yeah. As long as you can filter out the, worst case scenario
yes.
data that's out there and put yourself in the category of the ones who function and do well. And, because I think some people read it's a glass half empty, glass half full situation. And I think if you can go into that with the mentality of like, okay, how am I going to get on top of lupus as opposed to, oh, look at all these terrible statistics that I might be a part of. To me, I think that's part of it.
I definitely think that I filtered because it was really easy when I was first reading about it. At first, it was comforting to like read some of the chat rooms or hear some of other people's stories. And then after a while, I read like, okay, that's enough. Like, that's not helping me. Like, I need something like more motivating. I'm definitely in all aspects in like a positive reinforcement kind of person. So reading more of the things that are going to help me, the things I gave myself those couple weeks to just like sit in it, feel kind of victimized, feel kind of sad for myself. And then it was like, okay, like what can we do now? And I think having the right doctors too, Dr. Wallace he never made me scared, even though I was feeling some different things. He was just like, okay, well, we're going to do this, this, and this. So it always seemed like there was a plan. I always knew that if I called Dr. Wallace, he was going to give me a solution. So it definitely helped to have a good healthcare team for sure.
Yeah. Excellent. All right. Well, speaking of positives, we are going to take a quick break and come back and tell the rest of your story, which I think is really going to be inspiring to everyone who's listening. So we'll be right back after this.
Lupus LA's fellowship program is an essential part of ensuring the training of future rheumatologists. The nation is experiencing a serious shortage of pediatric rheumatologists. Today, there are approximately 300,000 children diagnosed with rheumatic conditions in the United States, but only about 250 practicing pediatric rheumatologists to meet this tremendous need. Call 310-657-5667 or visit our website at lupusla.org to support the efforts of Lupus LA.
We are back on the Lupus LA podcast, Your Story, Our Fight, talking to Risa Regalado. And before the break, we were talking about your positivity and gathering information. So I know when you started to get treatment, it was right around the time that Benlysta was being tested. Yeah. And so tell me the story of how you got involved with the early clinical trials of Benlysta.
Okay, so I was officially diagnosed in 2008 by a rheumatologist named Dr. Trom. When I had seen him, based off of, I think, my age, my situation, my diagnosis, he had told me that he felt like I would be a good candidate for a new drug that is being tested called Benlysta. And he was referring me to get treated by Dr. Wallace because Dr. Wallace, his practice was the one doing the clinical trials, so I would have access to these drugs. So I started with Dr. Wallace in 2008, maybe later on in the year, and I had signed up for the clinical trials because he said that he was pretty confident that they were working. I just wouldn't know whether or not I was taking the placebo or the proper dosage. So I signed up for the clinical trials, and I did the clinical trials for a couple years, but I don't know fully which one I was having. He thinks maybe I had the placebo or a very low dose, but it was exacerbated by the fact that I was actually in dental hygiene school at the exact same time. And I was on many other drugs like steroids and immunosuppressives. But in 2011, I believe, is when Benlysta was approved by the FDA in March, at least for lupus nephritis. It was the same time that I graduated hygiene school. And so I started to get better, and what seemed like pretty fast because I had already been under the study for 3 years. And little by little, every time I came in every month, it seemed like things were steadily improving. We were able to steadily decrease my steroids, which had really big effects on my body physically. And eventually, I want to say maybe like 2014 or 15, I got off all my drugs, and he said, I don't think you need to be on Benlysta even anymore. And to be honest, I didn't feel many side effects from Benlysta. I would get my infusion at like 6:30 in the morning, and then I'd run off to school or work by 8 o'clock. So for me, I had a really good experience with the infusions. It was just about making the time for it. But thankfully,
yeah, so did I. I was on it for a long time, and I felt the same way. It was very helpful, and I got to sit there and watch a few movies while
it was
when do you get to do that in the middle of your day, right?
Yeah.
And I should say, so I think what I'm always impressed by with clinical trials is the people that jump in first, or early. And tell me a little bit about that decision. Was there any trepidation on your part? Was there any concern about safety, about taking a drug, especially an infusion that, was brand new?
I think we started with so many other drugs first before I was put on Benlysta. I was put on Plaquenil, like I said, immunosuppressives and steroids being the worst of them. And I read about all the side effects that those drugs had. And when I spoke to Dr. Wallace about the possible side effects of Benlysta, it didn't seem as scary for me. And I was a bio major in college. So, a lot of these make sense to me. I understand the mechanism of actions and the biochemistry behind them. And probably more than anything, it was at that point, I was pretty, very much so confident in Dr. Wallace. And Dr. Wallace was very confident in the drug. He had told me that it's not a matter of time. It's not whether or not this will be passed. He's like, it's just a matter of when. So I knew that he's written the book on lupus,
Right.
I was pretty confident that I was speaking to a person that is highly educated about it, and he felt very confident about it. So I trusted him for sure.
Yeah, and I think the other aspect about someone like Dan Wallace is his office does a lot of clinical trials.
Yes.
And I think when you're searching for a clinical trial or you are asked to do a clinical trial, to me, that's one of the things that is important, is that the office and the doctors and the nurses, they understand how these things work and what the protocols are. And, clinical trials, I think, have become such a big part of treatment, or, in some ways they are obviously a barrier to getting drugs approved, in the sense that there's so many protocols. It takes so long.
Yeah.
Finding patients is really hard.
Yeah.
But when you get to that point with a drug, you're right at the finish line there.
Mm-hmm.
And so, I think they're so important. And we encourage a lot of people from Lupus LA to look for these clinical trials and really try to figure out if there's any that are right for you, because you're not only helping yourself potentially, but you're helping, vast number of other lupus patients by participating.
Absolutely. I know that sometimes clinical trials can have like a stigma of like kind of being risky, or, have some aversion because you don't know what the side effects are. But I actually had a totally different view. I felt lucky, actually. I felt lucky that my previous rheumatologist gave me, his contact information, and that I was even on the study, because even, online, when I had read some chat rooms, I'd read people that are in different, like smaller cities or don't have access to this kind of stuff. So I really felt quite lucky. And that was the words of my previous rheumatologist. He said, I think I would love to take care of you and keep you as a patient, but I know seeing Dr. Wallace is going to give you access to these, like, clinical trials that are at the forefront of treating patients. So I actually felt lucky that I was recommended, accepted, and treated, because I did get better because of it. So
yeah,
definitely.
That's fantastic.
Yeah.
Okay. So you become a dental hygienist. You're getting better sort of at the same time. By the way, it's ironic. Today, I literally went to my dental hygienist this morning. So there's a little PSA for good dental care, everybody.
Yeah.
So at what point do you start saying, how long have you been a dental hygienist now? Where are we in the timeline? But also, at what point do you start saying, you know what, I think I'm well enough to go back to that original dream?
So the funny thing is I became a dental hygienist, and I've been practicing for about a decade already. And to be honest, after I started to feel better, I kind of devoted my time and effort into just being as healthy as I could. I know that they said that I was officially in remission in like 2015, but the steroids I was on for like 8 years. And anybody that's been on steroids will know it can ruin you. I had gained 50 pounds while I was on it. I looked like a different person. I felt like a different person. So once I was taken off the steroids, because I had gotten better from the Benlysta, I turned into like a fitness fanatic. Like I did everything that I could to lose the weight. Like diet was always good. I tried to have a very anti-inflammatory diet, but I like deep dived into fitness, and that's how me and Shiva connected, because she did the same thing and worked really hard to lose the 50 pounds. And after I lost the weight, I started to think about, do I ever want to go back to dental school? And, that part of you kind of feels like that ship has sailed. And I felt like I was too old to go to dental school, too old. My grades maybe were too long until, like I would be accepted, and having to take the entrance exam. It just seemed like a lot. And so I sort of swept that under the rug and thought like, well, maybe that wasn't meant for me. Maybe it was just to go through this journey, and I, do my best to take care of patients through being a hygienist. But I think it was only until COVID happened. So just by complete coincidence, in the beginning of or end of February, I had approached that same doctor. I was working for him as a hygienist now. And asked him if I could do more in the practice, maybe buy into the practice, take more of a managerial job on top of being a hygienist, and just told him that I felt like I wasn't being challenged anymore. And he's a close family friend now, obviously, but he had said, I was just waiting for the time because I knew that you were sick and I wanted you to get better, but it's because you were always supposed to be a dentist. And I think that you should be a dentist. So he pushed me. I kind of laughed and thought it's not within my reach anymore, but when COVID shut down everything, I had 3 months to really think about it. And it gave me the time to actually study, in which I normally wouldn't have time to. So I told myself, if I put together an application, take that test, and, if I do well, I'll apply. And I did well and I applied, and the school that I go to now contacted me right away. And so I just felt like not a lot of people get second chances at things. And although I'm a lot older than I was when I first graduated, it's an opportunity that I had to take and kind of make up for lost time. And I don't know, like, a part of me also feels like, having been a patient for so long, I'm 1000% going to be a much better practitioner now, to take care of my own patients, because I know how it is to be my own patient, to be a patient myself. So
I was going to say that. I was actually going to say that I bet what you've learned from your lupus journey is really going to affect the type of dentist you're about to be.
Oh, absolutely. Absolutely. And like, it's always, I try to be as proactive about it as I can. Nowadays, thankfully, with all the technology and the information that's out there, it's being diagnosed more and more, autoimmune in general. And that was a big problem historically, that it's just, the symptoms are so ambiguous. It's very hard to get a lupus diagnosis, or they're sporadic. So now whenever I have a patient that talks to me about that, they think that their doctor thinks they might have an autoimmune, or they are suffering from lupus, I'm the first to spread the resources, or give them all the information that I have about what I've been through. I actually love to get those patients, because to me, it's such a huge part of my life.
So I find that really, it's moving in a way, because I think it really is that whole paying it forward, and you're in a unique position. I mean, you're seeing lots of people all the time,
Yeah.
And talking to them about their health issues. And I think there is some, autoimmune patients really do have to take care of their teeth in a way that other people don't, especially if you're on steroids.
Mm-hmm. There's a lot of oral health manifestations with lupus, and the medications that you take have a lot of side effects that can affect you, like dry mouth. There's a lot of ulceration, certain lesions that are identifiable when you have lupus. So that is definitely something that we see a lot in dentistry.
So what's your advice to somebody who may have just gotten a lupus diagnosis, that has a clear goal that they're shooting for, and now they think, I can't do this anymore?
Well, first and foremost, I'd say don't take it as a death sentence or handicap sentence. Okay. Especially nowadays. When I was diagnosed years ago compared to now, even the advancements are just astronomical, even with these biologics being approved, not just for lupus, but rheumatoid arthritis and other autoimmune diseases. There are so many different ways to treat lupus. I know it's very popular to say, what did you take? What did you take? Should I be taking that? And I think it's good to share stories, but everybody has a different diagnosis at a different level and has a different experience. But know that there is the perfect drug treatment for you. You just have to be patient. I think that's the number one thing, is just know that you have to be patient, but there is a light at the end of the tunnel, and you just have to be patient and try and stay positive. And also, have a good support team, because it's not always going to be easy. It's always going to be a little difficult, even if you're a strong person, even if you're independent. but 100% there are ways to treat it. And you just have to be really proactive about it also. But I'd say just gather the most information, right? With any problem, you want to gather the most information and try to make a plan. Make a plan that's reasonable within what your doctor is telling you and how you feel on a regular basis, but also have a plan B and a plan C, because we can only plan so much, but it doesn't always work out that way. And that's the thing with lupus is one day you can feel like $1 million and you feel like you can run a marathon, and then something can happen that stresses you out and you are just like need to take a day off and stay in bed. So just give yourself a little bit of grace and a little bit of flexibility, but I definitely think it's manageable, especially nowadays.
Terrific advice. So when are you going to be a dentist?
So I graduate in May 2026. And, assuming I pass all my boards, which I've passed a few of the boards already, then yes, I will be a practicing dentist in hopefully the summer of 2026.
Well, I have no doubt that you will pass everything and that you're going to be a terrific, terrific dentist. And thank you so much for sharing your story. I really find it inspirational.
Thank you. I'm so happy you guys had me on here, and I'm happy to, if anybody ever has any questions or looking for somebody to talk to, I always tell people I'm an open book and would love to help. So thank you for having me on here.
Thanks, Risa. On behalf of the entire team at Lupus LA, we thank you for joining the Your Story, Our Fight podcast. Please tune in, spread the word, and come back for more inspiring lupus stories. I'm your host, Adam Selkowitz, wishing you good health, and to always remember, your story is our fight.